So we will go through some epidemiological features. We go through influenza virus structures and mode of actions, types of influenza vaccines and their clinical applications, proposed type of vaccines for this year, for this season, and how to choose. I did yesterday, I think, a good algorithm for you. And what kind of epidemiological characteristics are useful for our everyday clinical practice? We know all these kind of figures. The influenza is the highest fatal and non-fatal virus, especially the last years. And we have to take into account that if we have an individual with chronic heart disease or chronic lung disease or both of them, then we have 5 to 20 more times prone to develop very severe or lethal case of influenza disease. You know that during the COVID-19 epidemic years, the influenza infections disappears. But afterwards, due to the several epidemiological and immunological factors, the period of outbreak changed and started earlier and was also wider. We have to take into account this. Especially for Greece, we have to delay our vaccination, our prescription, in order to have the 3-4 months of the full vaccination efficacy. During the months we have the high rates of incidence. So we have to start later than the North Europeans the vaccination, and in order to protect our patients better and longer, and to adapt to these epidemiological changes about the curve of the epidemic the last years. Also, we have to take into account that the individuals between 5 and 4 years are the most important age group for transmissibility, not for poor outcome. Although the older people have not so much importance concerning transmissibility, they are we have to be very concerned about their outcomes, because the majority of the cases with poor prognosis and poor outcome is among this in this group. I don't go through all this high risk population, because you know it's very common what is the explanation behind this, but I have to remind you that if you have mothers or fathers with children or child with specific autoimmune problems taking aspirin, they are risk group, not for themselves, but for the child. If you have a child taking aspirin, it's very crucial to vaccinate the parents and the child, because they are prone to develop, as Monica explained to me, the very difficult and lethal Reyes syndrome. So please ask the rare families about the children, their children, if they chronically taking aspirin. Another disease that we have to do, not so frequently, is the sickle disease. individuals. They have to do with us because they develop during the history, natural history of the disease, respiratory failure, type 1, possibly, but also they are developed also pulmonary hypertension because of the sickle disease. Also, we have to take into account that these rare individuals belong to the high risk population. Some very interesting characteristics about the structure and the mode of action of that virus. You know the pictures of this virus. Actually, we have 4 types of influenza. The interesting strains are influenza alpha and influenza A and influenza B. The others 2 are not so important for the people. We know that the surface protein H and neuroamidase are forming almost 131 subtypes combinations. Some of them are not important for us. Sometimes some of them are important. And influenza viruses and RNA viruses that bind to host cells and release genetic material into their cytoplasm in order to multiply the virus bodies. And if you another characteristic that we have to know is the subtypes, and we know that we have avian subtype or bird flu, also swine subtype or pig flu, and we have to take into account that the most important and common human diseases belong to H1N1, H3N2, almost pig flu, and we have also to take into account that some of the strains belong to avian subtypes are very fearable, and WHO and EMA and other organizations fear this subtype because from the avian are moving to the mammals. A lot of sea lions died that year from that kind of strains, and if that strain, if that type moved to the mammals, is very close to us, and perhaps to have in the future a pandemic similar to the COVID-19. So that is a fear, but we come to consider the subtypes that may cause problems are type A and type B, not type C. And now some other characteristics about the types of influenza vaccines and their clinical implications. We know that we have a characteristic of vaccine is if it is trivalent or quadrivalent, if it has 3 or 4 strains in it. Another characteristic is the technically issue of how we produce these vaccines. We have vaccines produced in egg cultures, produced in cell cultures. We have vaccines enhancing the response of the individuals, vaccines with an adjuvant factor or high dose vaccines, high antigens vaccines. And for these years, we will have possibly the only vaccine with live attenuated influenza virus released by nasal spray. And here are the indications for these different types in the market. We have the common vaccines, egg or cell-based for all of us. We have enhanced vaccines for immunoaging or other immunosuppressed individuals, and also we have nasal influenza vaccines for young people till 18 years old. And now I am turning to the issue of egg or cell-based. They have the same technology, except of the characteristics that they are cultured in different media. So there is a theory, but not only theory, that influenza virus bind to the host cells, and if we grow this virus in order to produce vaccines in eggs, we have a kind of, the virologists say that as soft mutations. The virus adapted to the eggs and produce neutralizing antibodies, and therefore the antigen affinity of the vaccine is diminished. So there are several publications say that maybe in the coming years the vaccines can be turned to the cell-based vaccines because of that. And we have some studies that this kind of cell-based vaccines are more efficacious than the other. We have another characteristics to keep also. This is because aging people have immunosenescence. They have diminished immune response, and we need, this is also clinically important because a lot of people hospitalized or have poor prognosis and poor outcome is belong to this group. So we have to add in the hard mutation of this virus also the soft mutations of this virus in eggs, to put also into account the immune weakenings of the elderly people. And to overcome this difficulty, the market have developed two different types of enhanced influenza vaccines. One is immune booster vaccines, included in that an enhanced immunological factor substance, and the other one overcome this problem by increase the antigenicity of these vaccines, creating vaccines with high numbers of viral bodies. The two are the same, they have efficacy, and we can see this in this very nice study that the enhanced vaccines have more efficacy than the common one. And we observed degrees in several outcomes compared the common vaccines to the enhanced vaccines in several outcomes. So we can see in hospitalizations, in cases, of course, and also in severe cases, perhaps cases, ICU cases. And now, in order to keep the time, we have to move to the proposed type of vaccines for the next year, for the next season. So all the organizations, FDA, WHO, and also EMA, propose to omit the B. Yamagata strain and propose for this season the trivalent vaccine and not the quadrivalent vaccine. This is the proposal for this year, so we have to do with the trivalent vaccine for today. And now this is the algorithm that prepare for you for everyday practice. First, ask if there is egg allergy. If yes, the second characteristic is to see if there is any kind of immune suppression. If you are allergic, if you have an individual allergic in eggs and is immune suppressed, then we have to go for adjuvant, for enhanced vaccine, manufactured in cell cultures. If no, we have to go to the common cell-based vaccine. If we have no egg allergy, we have also to consider immune suppression. If it is true, then we have to go to vaccine with adjuvant factor, either cell or egg-based. If no, we have to go to the SIB vaccine. Thank you very much.